You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast, and I'm very excited about this episode because it's the first one after about a year and a half of doing this podcast that I finally get to speak to a dentist, a dental practice owner who has had a practice for a long time and may have some beautiful insights and wisdom to share with us all. So I'm very excited to introduce Dr Jeffrey Kestenberg of Coburg Dental Group here in Melbourne. Welcome, Jeffrey.
Hello, Julie, and thank you for having me on the podcast. It's a pleasure to be here with you.
Oh, it's very exciting. And I've also got my buddy in crime, Amina Basile.
Hello, Amina, as well, of course.
to join me on this interview, because Amina and I, we've got our dental practice management program that we have the beautiful Jessica and Ika, who both work for Jeffrey, as students. Yep. And so Amina and I are in cahoots with that space, so I thought it would be a great chance for both Amina and I to start to share some of Jeffrey's wisdom together. So
Thanks,
sorry, Amina, I didn't get you to speak. Go.
That's okay. Thanks, Julie, for having me. And Jeffrey, I'm really excited to speak with you as well. We've seen your name floating around for many, many years and not had the opportunity to meet you. So we're looking forward to having a chat today.
Great.
Now, Jeffrey, when I was looking at your website, and you've got a great website, by the way, I really like it, and I got a lovely snapshot of who you are, and a couple of things jumped out at me. Number one, you graduated in 1980 from Melbourne Uni, and in 1981, you started working at Coburg Dental Group, and you're still there.
I'm still there. That's right, all these years later.
That's extraordinary. Tell us more about that.
So, originally, I came to Coburg Dental Group and it was to be a temporary job. So in my final year of dentistry, I decided that I wanted to specialise in prosthodontics. And the lecturer at the time said to me that it can take a few years of applying to get into what was then a master's degree program. Why don't you apply this year, being my final year of dentistry, and we'll register your interest, and you might need to apply for a few years. So I applied, and September of my final year of dentistry, I received a letter from the university saying that I've been accepted into the master's degree program. I hadn't even finished my undergraduate course yet. So, and the reason that I wanted to specialise was because it's an area of work that I really enjoy. Okay, an area of dentistry I enjoy is prosthodontics. That's principle number one. Anyone who works, whatever work you do, you have to enjoy it. You're not going to get any longevity if you don't enjoy doing the work that you do. Okay. Anyhow, so I was at Melbourne University and I needed a part-time job. And I had various jobs around Melbourne, but then the opportunity arose to come to Coburg, which was just down the road from the university. And literally, I could finish at the university at, let's say, 5 or 5:30 and then start working here, which was one evening a week, starting at 5:30, whatever it was, and on a Saturday morning. So that's how I started. But that was never the plan was never to be in Coburg. The plan was to go into specialist practice. And back in the 80s, specialist practice pretty much meant that you had a practice in Collins Street. So in the city, much the same as Harley Street in London, Collins Street in Melbourne. It's the same sort of thing, or was. There were very few specialists in the suburbs. It's such a different climate now where most specialists are in the suburbs and only a few in the city. It was the reverse back in the 80s. So I did my master's degree course, but working here in Coburg part-time, and I was very fortunate that I had some great mentors. So that's sort of principle number two. As a new graduate or a recent graduate, a young dentist, you need to have good mentors. You need to be surrounded by good people. So if you're in a job situation and you've got a lousy mentor, it's time to move on. You really need to, because we don't learn enough at university as undergraduates to be able to go into the workplace and to be a good dentist straight away. It's as simple as that, okay? So you need to have a good mentor. And that's what I had here in Coburg. I had a terrific mentor, the late Ron French and Robert French, who became an endodontist. They were the most, and Brian McGuinness, who was an orthodontist. Both of them, they're now retired. But I had 3 dentists working with me that were the most wonderful mentors. And they almost took me on like a son. It was just fantastic. But I also had the opportunity to go into the city after I finished my master's degree and work with the late Sid Warnke, who was a top specialist. He was a prosthodontist and he specialised in removable prosthodontics. So we're talking about dentures and partial dentures. So back in the 80s, implants in Australia were just coming into the fore. It was not really anything that was practiced freely like it is now, but removable prosthodontics has always been a big issue for dentists. So there was always a good market for removable prosthodontics and to get referrals. So here I had the opportunity to work with the top specialist in that area here in Melbourne. So I went into practice with Sid Warnke. So I suppose that's principle number 3. You need to find a niche, if you like, an area of interest where you have expertise, where you can have a point of difference between what you're doing and what the fellow down the road is doing, okay? So at the time, there were like 2 specialists in Melbourne, and I was going to be like the 3rd specialist in that area. So we started working, but when you're working as a specialist, you really need to walk the pavement, so to speak. You need to speak to dentists, and you're relying on referrals from other dentists or word of mouth from other patients. But you're starting off as a new specialist, you really need to go out and speak to people because you need patients to start coming to see you. You just can't, as a specialist, just can't hang up your shingle, your plaque outside and expect patients to be rolling up. And it's challenging to set up a specialist practice from scratch. I was getting a few patients from the other specialists, but not enough to warrant full-time work. So I was working part-time in Coburg still, part-time in the city. And I worked in the city for 5 years part-time. I hated it. I didn't like working in the city. Patients were complaining, parking, running late. We had the overheads in the city are horrendous because rentals at that time, it's much less now, but it's the rentals were high. Every square foot, so to speak, of rental space was important. We had small rooms, low ceilings. It was an old building. And I was in a situation where the senior practitioner, he was in his senior years, I was a young guy, and whereas I wanted to invest in new equipment, he wasn't at that stage of his practice anymore. We weren't exactly on the same page. We had the same page in terms of patient treatment, but I had a different vision of where I wanted the practice to go. So I stuck it out for 5 years, and eventually I gave up the city and decided to come full-time to work in Coburg. But I was an employee. I was still getting some referrals, but I decided that specialist practice was not for me. I didn't like it. I didn't like it because I was getting every other dentist's headaches. They would try to make dentures, the dentures didn't work, and then they would send the patient to me, and then I had to deal with it. So the issue then became that I wanted to charge the patient for the work that I did, but the referring dentists weren't always so forthcoming in giving a refund to the patient. They had done some work, they tried their best, didn't work out. So we always had this conflict. I wanted to keep when you're a specialist, you have to keep the referring dentist happy and the patient happy. And it doesn't always work that way. When you're a specialist and the referring dentist has stuffed up something, you have to be honest with the patient and tell them, and then it can strain your relationship with the referring dentist as well.
Gosh, that would have been quite a learning journey of how to manage that well.
It was not pleasant. So I decided general practice was for me, but I still wanted to keep that niche of doing removable prosthodontics. So that's another principle I think that's important. As a dentist, you're into marketing, there has to be a niche, there has to be a point of difference between what you're doing and what the person down the road is doing, okay? So I'm always looking out for where's that point of difference going to come, okay? So in realising that prosthodontics was my thing, back in 1982, I decided that I was going to do a course that was run by Noble Biocare on implants. This was early days with Pat Henry, who was in Perth. And the way that it worked back in those days was you had an oral surgeon, you had to go as a team, and we had to do our training together. So I had an oral surgeon organised, and off we went to Perth, and we started offering implant treatments. And we were like one of the first in Melbourne to offer implant treatment. And the way we learned it was basically 6 implants in the lower jaw with a full arch of teeth. That's how we started off learning. There was no single tooth implants. There were no bridges back in those days. It was only lower jaw. Upper jaw was unsuccessful. And it was challenging, but what a great niche that was.
Extraordinary niche. And how did you go with explaining the concept to patients who had no awareness of it up until that point? They may have heard about other prosthetic devices around the body, but not for teeth.
Right. So we were fortunate in that Bronnemark, who developed the original implant system, had been using the system since 1965. So we had 15 years of data to explain to the patients that this system works, but it was new to Australia. Okay. But like any treatment that you involve presenting to the patient, you have to be able to present that treatment plan to the patient and explain things to them with confidence, that you have confidence in doing it, that this is the sort of treatment that you would have done on yourself if the patient's mouth was your mouth. That's how I treat my patients. And indeed, I use those words with my patients still to this day. What would I do in your mouth if your mouth was my mouth, right? Or with kids. How would I treat your child if your child was my child? Okay, so for me, it's about presenting ideal treatment plans. Okay, now, if the patient then doesn't want to go with the ideal treatment plan, we have alternatives. We explain the advantages and disadvantages of the alternatives, but the patients then understand that it's a compromise. Okay, so that principle hasn't changed at all. Okay, what has changed, of course, is that that niche market of implants is no longer a niche, because every Tom, Dick and Harry now is offering implants to some degree. Okay, so it might just be the restorative, it just might be the surgical part, and of course there are general practitioners now that are doing the surgery as well as the restorative. That's been going around for a long time, but back in the early 80s, it was only surgeons that were doing implant surgery. So we've developed other niches over time. So another niche for us in Coburg, and this was going back even before my time, was sleep dentistry. But that is offering general anaesthetic or sedation administered by an anaesthetist in our rooms. Okay, so that's getting into a hospital can be difficult to do dental work, but this is offering it in our rooms. Now, back in the 80s, we had an anaesthetist who used to come. Everything that he needed was in a briefcase. That was it, okay? And he would come in and he'd administer the anaesthetic and everything was fantastic. There were no real regulations related to it, and we offered the best of service to the patients, and we had patients coming from all over Victoria for so-called sleep dentistry, which we still do. Yeah. Of course, now there are regulations. We've got special equipment. The equipment that we've got in our surgery now is virtually the same as you have in a hospital. Yeah. Okay. You need accreditation. The facility needs to be accredited. There's a whole lot of red tape now, but I believe it's worthwhile doing. So that was an interesting time in the beginning when we were doing sleep dentistry, and we still do offer sleep dentistry. And it's a niche that we have maintained. Okay, but we've had to develop other niches as well. And so for me, and more, let's say, in the last 20 years, has related to using a laser. Okay, so laser dentistry was a big deal. So back in 2002, when water laser was introduced into the market. It was actually introduced into the market to be a soft tissue and hard tissue laser, which was going to replace the drill, and it was going to be no pain, no drill dentistry. And that's how it was going to be marketed. Okay. And in terms of the hard tissue stuff and replacing the drill, in my opinion, it was a disaster. Okay. So it works, but it was much less efficient than the drill. It wasn't no pain. We still needed to use local anesthetic for many patients. And after several years of persisting with it and using it sometimes in that situation, I just got rid of the no pain, no drill concept. Okay. But still very active in using lasers for soft tissues.
And it's interesting when we're talking about the different pieces of equipment that have come through and the different technologies that have come into dentistry over the decades and will continue on in the future as well. At what point do you start to invest in these new technologies, and at what point do you say, no, I'll sit back and I'll just get my friends and colleagues to run through the mistakes first and then I'll purchase after the fact?
Yeah, okay. So if you speak to my accountant, he'll say, Jeff, you're buying this, you're buying that. It's affecting your bottom line because you're leasing expensive pieces of equipment. But when you need to do an assessment on your return on investment, it's like any business, okay? So, and I suppose I received a lot of my business acumen from my father. So my father wasn't a dentist or anything, but he was a businessman who was in the kitchenware industry. Okay, so but the principle is the same. You want to invest in a new warehouse or a new retail outlet. You're looking at your return on investment. When I bought the laser, for example, back in 2002, it was $140,000. Back in 2002, I could have bought 2 Mercedes-Benz for that quite easily. Okay, I went to a seminar and I signed up at the seminar to buy the laser straight away, okay, because I could see, I did some sums, I worked out the return on investment was there. I came home and I told my wife that I bought this laser. She hit the roof. Okay? When I say return on investment, you need to look at the current way that you're doing something, how you're going to do it with your new piece of equipment, and what the difference is between the old fee and the new fee, so to speak, and how long is it going to take you to get your money back? Okay, that's what I look at as return on investment. Not what is the total fee of the new piece of equipment, what is the difference going to be? Okay, so I want a return on investment on a big piece of equipment, 5 years. That's what I'm looking at. Okay, the laser was 18 months.
Whew.
I had my return on investment in 18 months. Okay, it was fantastic. It was absolutely fantastic in that purely accounting terms. Okay, my accountant doesn't question me now when I'm looking at new pieces of equipment. On the contrary, he wants to know what my new pieces of equipment are lately. Okay, because he's interested. Okay, so we've invested in lots of other equipment that then creates a point of difference between us and the fellow down the road. So another example, which is nowhere near as expensive, is the Wands local anaesthetic system. I personally believe every dentist should have the wand local anaesthetic system, which is about $5,000 or thereabouts, or the DentaPen. Okay,
Yep.
so the DentaPen is a similar thing, doesn't quite have all the same bells and whistles, but it is a much gentler way of delivering local anaesthetic to a patient.
And that's
Okay?
one of the biggest deals for a
The
patient.
biggest thing, the biggest thing, there was, I can't think of her name now. There was a practice management consultant who used to come from the state. Linda Miles, is that the name
Yeah,
of Isabel? Linda Miles.
a previous guest on my podcast.
Okay, so I remember going to Linda Miles, and she said that if there's one area that dentistry needs to improve, it's giving a shot, as they put it in the United States. And if you get a reputation as a dentist as giving a painless injection, giving a good shot, the patients will flock to you. Okay, that's what the wand lends itself to, or the DentaPen. Okay, so I use that routinely. I don't charge extra for it. I have to explain to the patients what it is and what the beeps mean and all that sort of thing. But the patients love it, and then they come in and insist on having it. And then from time to time, I'm getting referrals, patients word of mouth. Patients coming in saying, "Can you use the wand?"
And that's the return on investment, isn't it?
So it's not measurable like it was with the laser because I'm not charging extra for it, but what a difference it makes for the patients. And I'm conveying to the patients that I'm caring about the fact that I don't want to hurt them. Okay? Then I have the opportunity of numbing up a tooth and not having a numb lip, for example, or a numb tongue.
Oh, really?
Yeah.
So for the real ouchy injections that we don't like, or I don't like
Yeah.
blocks and palatal injections, is
Mhm.
a big difference, is there, in the...
Big difference. Big difference. Big
You've
difference.
just got yourself a new patient,
Yeah.
Dr. Kestenberg.
For me, that's a no-brainer. Okay. About 6, 7 years ago, we invested in CEREC. Okay, so scanning patients with the scanner and then milling restorations in the surgery. The return on investment on that has also blown me away.
Great.
Blown me away. The patients love watching the CEREC milling their crowns. It's fantastic.
That's interesting because I follow Dr. Howard Ferran from
Yep.
America.
Yes, as do
And
I.
I've heard him say on many occasions, and I don't have a particular, thought around this, but I've heard him on a number of occasions say, patients don't care, in his raspy voice, patients don't care whether they get their crown on the day or they have to wait 2 weeks down the track. But it's been your experience that I didn't realize that you can actually, that you'd have the milling machine sitting there for them to actually watch that be milled. But you're saying that indeed it has been a draw card.
Right. So put yourself in a patient's position. That's how I often look at it. Patients are time poor. The sorts of patients that I attract to my practice are patients who can afford high fees. We need to discuss fees as well, but that's another slightly different topic, okay? I'm attracting professionals. I'm attracting mums with kids. I'm attracting people who coming to the dentist, making an appointment is always an issue. I need to get back to you. I need to check my diary. I need to check work. Even just finding a time to make an appointment can be an issue, which is why, by the way, we are open 7 days a week.
Oh, I love that.
And evenings.
That's so great. That's wonderful.
Because then there's no excuse. There's no excuse. We can find the time for you. You just tell us when. Okay, we're open.
And it's another point of difference being open.
It's another point of difference. So, if I can say to the patient, we can do your crown in one visit, and as opposed to coming in, having an injection, drilling, taking an impression, that awful muck in your mouth, then a temporary crown, which may fall off, and then you need to come back and have it re-cemented, Then you come back 2 or 3 weeks later, we numb it up again, take off the temporary crown, clean it all up, fit the crown. Hopefully it fits, and then we glue it in. If it doesn't fit, we'll need to take another impression and then put the temporary crown back on, get you back and do it.
Yeah.
As opposed to with the CEREC, numb it up, drill, scan, mill, try it in. If it's okay, if I'm doing Emacs, for example, then back into the furnace, because we've got the furnace as well, of course, try it in. It fits, we're done. Start to finish, 2 hours maximum for a crown. Okay, now in the beginning it wasn't 2 hours. There's a learning curve. With all new technologies, there's a learning curve. With all new technologies, there's stress. Part of that learning curve, getting used to it. You make mistakes. So in the beginning, we were allocating 3 hours, but then it didn't take long before it was becoming 2.5 hours. Now I can do a crown in 2 hours. The actual preparation time of a crown is the same. The numbing up is the same. The drilling is the same. I'm much quicker now scanning, whereas beforehand it wasn't so quick. And then the milling of the machine is the same. The time in the furnace is the same. I've trained my staff to do a lot, setting up the mill, putting the crown in the furnace and all that sort of. My staff did that. I don't do that. So while they're doing that sort of stuff, I'm doing something else. I'm either doing something else for that patient. So if a patient needs a crown and a filling, while it's being milled, I'll do the filling. Or while it's in the furnace, I'll do a filling. Or that patient will go and wait in the waiting room. I'll see another patient, or I'm doing a check visit, a dentist. I'm doing something else. I'm using my time productively, not sitting around doing nothing. So you've got to work out your appointment book properly as well to use your time efficiently. So the CEREC, and there are other systems as well. The CEREC has been fantastic.
Wonderful.
So when I look, I'm always looking at new technologies. 3D printing is something that a lot of dentists have got into, and I'm not quite there with it yet. It's not going to be far off before I do invest in it, but it needs the software. I think needs a bit of zhuzhing up, so to speak. It's needs to be a bit more intuitive, and I want it to be software that my staff can use. At the moment, they can't. Okay, so maybe 1 or 2 of my staff members can, but I want all of my staff to be able to use it. 3D printing is not quite there in that respect, but it won't be long.
Yeah.
So,
have you seen the first evidence of AI hitting dentistry?
I love AI.
It's exciting, isn't it?
I'm a fan too. AI.
I'm rejecting all the drawbacks to it, and I'm just embracing the benefits.
But you need to be careful with AI, because AI is taking information off the internet, and it's the computer system, so to speak, is learning off the internet. And I don't need to tell you that there's plenty of incorrect information on the internet. Okay. So, for example, if you want to write a poem to your loved one, AI is fantastic. No problem about that. If you want to write, for example, a condolence card to someone, you always find it hard to find the right words. AI is fantastic. I recently decided to test it out and write an article for me on the relationship between heart disease and periodontal disease.
Great.
It was pretty good.
Pretty good.
I had to tweak it a little bit here and there, but it was pretty good. Okay. I had to write a letter to a job applicant who was not successful.
Yeah,
AI was
sensitivity. AI is very good at being sensitive.
AI was terrific for writing that letter, and it took like 10 seconds, So you've got to use it, but you need to understand that it's got limitations. And when it's coming to something that's scientific or related to our clinical work, you need to be careful that it is accurate, because there have already been situations where lawyers and medical practitioners have got themselves into trouble because of inaccurate AI information.
It was actually pretty impressive back in when was Melbourne ADX? It was relatively weeks, months ago.
Yes.
And I don't think I'll remember the name of the company, but they had an AI dental diagnostic tool where, they have uploaded thousands and thousands of OPGs, radiographs intraoral images, etc., and you just load up a scan of someone's mouth and their bite-wing X-rays or their OPG, and it will come up with everything that it diagnoses on your behalf as well.
So to pick up caries, for example, on an X-ray.
Yeah.
Okay, so these are exciting things, but it's still, we need to understand it's a machine and the computer doing it, and they'll still need a dentist to check and verify that it's correct.
Yes, and I've also heard that AI only uses data up to the year 2021 as well. So if there's been new things coming through over the past couple of years, and as we go, it becomes a bit more dated as well.
Yeah, and look, I'm sure that's going to change as well. Yep. So, there's new technologies that's being beta tested, for example, which are things like robots doing crown preps for you, where you basically hook the drill into the patient's mouth and the drill is robotic and out comes a crown prep. Robots doing root canal treatment. So, these are things that are being tested at the moment, and lots of manufacturers are coming up with new ways of doing things. And that's why we go to dental exhibitions to find out what's happening and what's new. So I love going to dental exhibitions. You mentioned, ADX, which I think is terrific, and I think that everyone needs to go to those things to just see what's happening, not necessarily to go and buy things straight away. They need to work out where they're at and where their niche is going to be and what they think is appropriate for them. They need to train up and get their staff on board as well. So, but yeah.
I love that. One of the other things that I picked up when I was reading through your website was looking at the other practitioners that form part of your team. They've all been there for ages and ages.
They have, and we've got new people as well. So one of the dentists who's been with me for a long time, his niche is orthodontics. Now that might sound a bit weird, but we're offering orthodontics as a general practitioner doing orthodontics. Okay, so it's much more cost effective for the patients, and we make it very clear to the patients that he is not a registered specialist orthodontist, and that if the case is beyond his capability, that he will refer on to an orthodontist. But the patients love the fact that we're offering orthodontics in-house. So, I don't know, I think it's still the case now. Orthodontics is not well taught at undergraduate level. You need to do some sort of postgraduate education, and there are some really good courses around. And I'm not talking about doing a weekend course or a 6-week course or something like that. I'm talking about doing a 2-year program of doing a good comprehensive orthodontic course and having a good mentor. Okay, so you need to have, it's fine to be doing orthodontics, but you need to have a good mentor. And I'm not just talking about doing something like clear aligners, like Invisalign as an example, and there are other brands around as well. I'm talking about offering comprehensive orthodontics, braces, the whole works, and doing early intervention orthodontics, which is something that a lot of specialist orthodontists who do conventional orthodontics don't offer their patients. So that's another point of difference that I have developed, that we have developed for him as well. He's more than half of his week is just doing orthodontic treatment, so within the practice. And then I've got, there's another dentist now who's soon to start a postgraduate qualification in prosthodontics, but particularly looking at more aesthetic type dentistry. So that's not necessarily a niche. A lot of dentists offer that. But where the niche is how you market it, and the fact that you've got a postgraduate qualification in that. I think a lot of patients like when they see that qualification, that makes a big difference.
Well, that lends itself directly towards the trust that they're forced to put into that practitioner to be able to get a good result with that.
Yes. So I'll just say one more thing while I think of it. You've mentioned the website several times. It's really important. I can't emphasize how important it is to have a good website. Okay, and every patient that is going to your practice is going to look up your name on the internet. Okay, whether or not it's the next door neighbor. Let's say the next door neighbor says, "Go and see Jeff Kestenberg. He's a great dentist." And the next door neighbor says, "Yep, I'm going to go and see him." the first thing that new potential new patient is going to do, even though the neighbours recommended me, is look me up on the internet. Okay, so you need to have good internet presence with a good website. And I can't believe how many websites I see on the internet from dentists and doctors and the like. They're terrible.
Yeah.
Terrible websites. Even practitioners not having a website at all.
Or it looks like it was a cut and paste one from the 80s.
I can't fathom it. You need to have a good website. You need to do good search engine optimization. You need to be updating your website all the time. You need to be giving information. You need to encourage people to click onto your website. It's for me, it's number one. Number one, so important. You open up a practice, get that website happening, and not have for too long, this page is under construction. Right? That's so frustrating.
And what patients are trying to search for is reassurance, an expectation they should have coming in there. Is this the place for me?
Yeah.
And so the minute you don't have your team members' faces up there, they don't have your dental surgery spaces and chairs on the website, they still don't get a chance to engage psychologically or emotionally with your practice. And so that's one of the things that I love about your website is that you get a very clear picture of what it might be like walking through the front door.
Yeah. And let me tell you that I'm not happy with it at the moment.
We never are.
We're not happy with it, and we've got some plans to improve on it even more so. Okay, so
Beautiful.
Really, really important. Yeah.
Meaning?
So one of the things I've heard about you, Jeff, is that after speaking to a couple of you, look a little bit apprehensive there. After speaking with a couple of your staff members, is that Julie started down this track before, that you've got some very long-term staff there.
I do.
This is a very big achievement. And I'd like to hear from you how you've managed the staff so well and retained them so long.
And yet I speak to colleagues, they struggle to get staff. Yeah? I don't struggle at all. And at one stage, I don't think I have anyone at the moment, but we've even had a waiting list of people who want to come and work for us.
Goodness me, you've got to go out in the speaking circuit.
But I don't think I've got a waiting list at this very moment. So look, here's the thing. I'm very passionate about this particular topic as well. Every time you employ a new staff member or a staff member leaves and you need to employ someone, whether a trainee or fully trained, they need to be taught again. Even a fully trained person needs to come in and learn the way that we do things, and it's always going to be different to their previous job. That's costing you efficiency and that's costing you money. Okay, so that's the first basic thing about it. Okay, so every time you're turning over staff, it becomes an issue, but it's not only costing you money, it's costing you stress as well, just onboarding a new staff member. Okay, and for example, onboarding a new dentist, for example, can take like 2 weeks before they even start seeing their first patient. It's not just a matter of throwing them into the surgery. I want them to watch me, see how I talk to the patients. They need to learn about the equipment, all about the technologies. They need to get a feel for the place and understand what our treatment philosophies are, because we want it to be consistent across the board. Okay, so we've got about 30 people working here. So we want to be consistent with our message to the patients.
And if I could just quickly interject, your notation around the importance of observation, that's extraordinary. That's telling exactly, this is what success looks like to us in the way we communicate to patients, the way we behave with one another, our adherence to all the systems. This is what it looks like. And you can't be clearer.
Yeah. So for example, we have a new graduate dentist. I love employing new graduate dentists, which I've done over many years. It was 2 weeks just observing me. And now when there's an opportunity to observe me, even though it's now 7-8 months into the year, observing me again, or if not me, one of the other dentists. We have regular meetings where we discuss cases together and that's with actually all the dentists, where we get together to do a bit of professional development, discussing interesting cases and so on to improve the service that we offer. Okay, but new dental assistants seems to be a big issue for a lot of dentists, and I know there have been a lot of dentists that have been complaining on the internet and to the ADA about the short supply of staff around. There are a whole range of reasons for that, but for us, it was not. It hasn't really been a problem. So we've had some staff that have left, of course, for various reasons. But for example, my nurse, my chairside assistant, has been with me for 28 years. I've got, and she's got no intention of leaving. She's said to me several times that she's my dental nurse until I retire, which I've got no plans of retiring, but that's just how it is. She's with me until then. I've got receptionists who've been with me for 20 years. My practice manager, Jessica, who you know, this last week she celebrated 15 years. Another one's 30 years. Another one's 35 years. It's these people enjoy coming to work, and I think part of the reason is my whole philosophy on how you need to employ people. And that relates to the first principle is that family comes first. Okay? So I'm very accommodating when there are family needs, whatever that family need may be. Need to look after elderly parents, children, whatever it may be, family comes first, and we need to fit in with that. So that's the first principle, that they've got the confidence knowing that they can come to work, and they're very conscious of that. Second of all, I want to make the work environment as pleasurable for them as I can. We don't want, you have to enjoy the work that you do.
Absolutely.
So if you don't enjoy the work that you do, eventually you're just going to give up on it. Okay? So you want a work environment that is not toxic. Now that, for me, is the biggest challenge, because we all have different personalities, and when you employ a lot of people, as we do, we have 30, which I think is a lot by industry standards, but even if you have just a few people, I think it's worse. If you've got, let's say, if you're employing, let's say, 3 people, and one of them is toxic, you're in big trouble. You lose that one person, and usually trying to get rid of, so to speak, that toxic person can be very difficult, right? It's not that easy to get rid of someone, so to speak. But if you're employing 3 or 4 people and you get rid of one, you've lost 25 or 30% of your workforce. That's a big issue, okay? So you want to create an environment that's not toxic as well, and you need to have some sort of way of resolving those issues. Yeah. So communicating with the staff and making sure that they're happy is important. Now, things are going along very rosy and you think everything's going okay, you might tend to get a little bit lax on that, and I've been guilty of this as well. You think everything's going along nicely, and all of a sudden things become an issue when they didn't necessarily need to become an issue if you just would have communicated properly. So communicating with the staff is really important. Now, how you do that, there are various ways of doing it. Okay, staff meetings. Okay, having a morning huddle maybe. I don't find the morning huddle is really effective. Not for me in particular, because, for example, with me and my nurse who's been with me for 28 years. She remembers every patient. She knows exactly what needs to be done. I don't need to tell her anything. On the contrary, she's telling me what needs to be done. Everything's there. I don't need to think twice about it. You know, I'm doing, let's say, a composite restoration. The next instrument that I'm going to use is already in her hand, ready to pass to me. You know, I'm not even thinking, because, you know, in the past I've trained her. She knows exactly what needs to be done. And it just runs like a well-oiled machine. Okay, so for me, the morning huddle's not important, but for many work situations, I think that's important. Go through your day sheet, plan, know what you're doing. Okay. Staff meetings, I think, are really important. The staff like it. We had a period of time where we weren't doing the staff meetings anymore because I don't always find that an effective way of communicating. And not always can everyone come to the staff meeting. If you're open 7 days a week, then the week I have different staff on the weekend, during the week. You can't force people to come if they're working on the weekend. You can't force them to come in the middle of the week. It becomes a bit of an issue. So I've never had a staff meeting where everyone has been there. Okay. But the feedback that I'm getting from my staff is that they like the staff meeting. So the staff meeting is there, but it's not my only way of communicating. We have a WhatsApp group. Not everyone likes that either, but we have various systems. So sometimes I'll put out a memo and we have a list of names attached to the memo. And when you've read the memo, you've got to tick your name off that you've read it and it gets passed on to the next person. So you need a variety of ways of communicating to the staff, because one of the big frustrations is when they don't know something. I wasn't told about this. Then because they want to know. Your staff are there and they want to see the best for your practice. It's in their interest that your practice is successful. Okay, so they want to work with you, but they can only work with you if you can communicate properly as to what you want to have from your staff. Okay, so my staff, I think generally, without exception, they want to see the practice being successful. We're all on the same page. They're not coming to work starting at 9 o'clock, finishing at 5 o'clock. That's not what they want. They want the practice to be successful. They also want some sort of recognition. I've been a little bit slack in that in the past at times. They want recognition, and it's important that they have that recognition at a personal level, but also in front of their peers as well. Okay? So when something out of the ordinary is being done by someone, some sort of recognition. The employee of the month thing is not a bad idea, but all these things can have an issue. Why was she the employee of the month for doing that when I could have been the employee of the month because I did this? So it just, they need to understand that, in reality, everyone's going to be the employee of the month at some stage for doing something I want to recognise. But when something special is being done, I want that to be, so that's just another way of being recognised. But
I think the recognition part of it's very important. And quite often as managers and owners of a dental practice, you can see people doing beautifully well in their role like they always have done for the past number of years, in your case, past number of decades. Yeah. And so you think, I won't mention that, but I think there's enormous value in calling out the regular, routine, wonderful performance that people do put on. One, as you say, it's recognition for that person, but also it's telling the rest of the team members who are in listening range that's really fantastic performance there.
Yeah. Now, not a day doesn't go by where I don't finish at the end of the day and say thank you to the staff. It's just so simple. Thank you for today. Today was a really tough day. Thank you for, I recognise that you need that, even just that little informal, quick 15-second recognition at the end of the day to say thank you.
Love it.
So important. You also invest, in continuing education and things like that. I know you've got a couple of your staff members involved in our dental business mastery and practice management.
Yes. So we've got two of our admin staff are certainly doing your program. And look, did I recognise a need for that? No, not necessarily. But I've seen the benefits now because they've come back to me after they've been with you and they've come up with some fantastic ideas that I had never even thought of. So thank you for that. And look, I can certainly recommend your program to everyone's admin staff. They're going to come back with things that will only benefit your practice, because if the admin, the reception is like the heart of the practice. Okay? The heart of the clinical practice is the hygiene department. if you don't get your hygienists getting the patients to come back and you're not doing the checkups, then you're not going to have the patient flow that you want to have either. Okay, so the clinical heart, if you like, for me is the hygienists, and it's the admin staff that are really going to determine the success of your practice. Right? It's that phone skills as well. Picking up the phone, the first 10 seconds of someone, of answering the phone makes a big difference.
Big difference.
Answering the phone with a smile. I know that's something that you talk about. So training is important. Yesterday we had training. It was pediatric CPR. Okay, so we do a lot of tongue tie stuff with babies, which I've developed. That's my latest niche, if you like, for the last 15 years or so. So I need to make sure that my staff are trained in pediatric CPR. And in a few weeks' time, we're going to be doing general CPR. But the staff love the fact that I will block off half a day or a day for continuing education. Okay, but we even do simple things like getting a sales rep, like it could be the sales rep from GC, for example, that will come in and do a lunch and learn with the dentists. Or we have a meeting with the dentist where we discuss patients. I'll take my staff, for example, to ADX, as you mentioned before, to the dental exhibition, and they'll go around and they'll find things and they'll talk to me. They love it. I took ADX Brisbane. We took, I think, about half a dozen staff up to Brisbane, and they spent a couple of days up there, and they had some fun, and they came to ADX for one day. So we want to do that sort of continuing education, of course, and every time you introduce a new piece of equipment, there's education around that.
Wonderful. Continual growth and learning.
Yeah.
I want to make sure you get some lunch too before you have to go for your afternoon sessions. So if you could briefly just touch on two more elements, your patient communications and how that evolved, and also the importance of your own self-awareness journey in practice ownership and team and patient management.
Yep. All right. So in terms of communicating to patients, as a general rule, most new patients will come into a general practice because they've got an issue. So that first visit is just about getting them out of pain and just doing something very basic for them, and maybe showing them something or get them out of pain. So it might be an open and drain or extraction, whatever. But then using the intraoral camera and going a quick tour around the mouth with the intraoral camera, saying, look, I think you've got a hole here, you've got some characterless here, you've got this here. I want you to come back and have what we call a new patient examination. I'm going to have a look around your mouth, and we will probably need to take some x-rays, or we will be taking some x-rays, and this is how much it's going to cost, and then I'll sit down and work out a plan for you. If it's a complex plan, I'm going to get the patient back another day. I'm going to say to the patients, all right, I'm going to have a look at these x-rays, study models, scans, photos we might do as well. I'm going to have a look at the photos and the x-rays and the molds of your mouth and work out a treatment plan and if there's choices, how we're going to tackle that as well. But let's get you back because it's a bit more involved than what I originally had thought or whatever. But I like to get patients back at no charge and sit down with them for half an hour or so and explain the treatments. Once again, using the intraoral camera, that when they can see on the screen that black hole, when they can see the faulty margin on the old amalgam, the cracked amalgam, it's the response from the patient is, how quickly can we get this done? Because they're not aware, because there's no symptoms. But when they see it on the screen. And so in terms of, we were talking about equipment earlier, you must have an intraoral camera. Okay? If you don't have an intraoral camera, you can't communicate properly with your patients. That's my opinion, right? If you're going to have a normal clinical camera, that's fine, but you've got to take you've got to upload. You want to have it instantly there. The patients can see the images as they're coming up, as you're looking around. So for me, that's really important. So that's how I communicate. They get a written quote, and that quote is fixed for 12 months. And I say to the patients, this is my order that I think this is the priority that we need to do things, but I'm flexible. I'm flexible. Do you want to do one filling at a time? Do you want to do 10 fillings all in one go? Whatever. We need to be flexible in how we go about doing it, but this is your ideal treatment plan. But doctor, I can't afford all that. Okay. Let's work out a priority and work out how we can make this more affordable for you. So is it going to be Afterpay, another payment system? Is it going to be, do we need to facilitate early withdrawal from superannuation, which I don't like, by the way, and I tend not to recommend because I don't want to be patients' financial advisors, okay? But sometimes patients look to that, even though I don't suggest them. I know that there are dentists that do. Philosophically, I've got an issue with it.
It's a murky water.
Yep. So
you need to know much more information about that patient than just their oral health to be able to make that suggestion.
We have payment plans. We can spread out the treatment over 12 months, prioritise some teeth over other teeth. There are ways that we can get around it. And it's amazing. And you can never judge a patient by their appearance. Okay? So I've been amazed by some patients who can afford the most complex, detailed, expensive, when I say expensive is the wrong word, treatment plans which are a lot of money, okay, and they can afford it, it's no objection, and you look at them and, we can't be judgmental based on people's appearance because then you might look out the window and see this dishevelled person hopping into an S-Class Mercedes and you think, oh, well, what do I know, about them? So I always offer the ideal treatment plan, okay? And the other thing that I always do is I want to offer the very best of service. And the only way that I can offer the very best of service is to make sure that my fees are appropriate and that they're fees that I'm happy with, to be able to work with that patient in a calm manner, not racing from one room to another. So we are a high fee, but best of service practice, okay? So we offer the ideal, but we sit down and spend time to explain these things to the patient.
Yeah, I love it.
Now, what was the second point that you wanted?
The second point, and it's just ducked out because she had a meeting to go to,
Sure.
but your own level of self-awareness, how important that self-awareness journey is when, one, you're a dentist with ongoing relationships with patients going on, but also if you're a practice owner and you've got a team to manage and a business to manage as well.
Okay, you need to surround yourself with good people. It's as simple as that, because it's not really a self-awareness. It's an awareness of other people that are giving me feedback, okay? So I've surrounded myself with the most wonderful people. Jessica, who's my practice manager, the most wonderful person. Her predecessor, who was with me for 28 years, was the most wonderful person as well, okay? So my other staff that have been with me a long time, my nurse who's been with me for 28 years, there's not a day that she doesn't have a go at me about something, right? And it might be something silly, like, well, not necessarily silly. I forgot her birthday about a month ago. That's been a bit of a disaster, but another story. But, I surround myself with good people, and I've got really good family support. As I said to you before, family is number one. My wife has been absolutely amazing in supporting me. But I've also sought help of other professionals because I can't be the expert in everything, okay? So that self-awareness is actually awareness of other people coming back to me. So I'm seeking out help. So I have coaching as well, so it might be my accountant that's coaching me on financial things, or it might be the equipment specialist who's coaching me, or it might be just talking to other people. We did a major renovation here during COVID, but I'm not an expert. I'm not a developer. I'm not a builder. I went to people who are experts, architects who are experts, the fit-out specialists who are experts, and they helped me. I sought their advice, and then I suppose that awareness has come from those other people because I've surrounded myself with the right people.
Yeah. Yeah. I love it. I love it.
Yep.
Jeff, I will let you go off and have lunch in the 9 minutes that you've got left. But very quickly, for all of those younger dentists out there that are looking to be following in the footsteps of somebody who's very successful at what they do, you need to enjoy what it is that
You
you
need to
do.
enjoy your work, right? I don't enjoy all aspects of dentistry. I don't enjoy doing root canal treatment. I don't do it. I handball it to one of the other dentists. I don't enjoy doing perio. I handball that to the other dentist. But that's me. You, as a new graduate, you probably want to do everything, do a little bit of everything, and you need to enjoy what you're doing. If there's something that you don't enjoy doing, then you need to get some further education in that area, and you need to have a good mentor.
And the need to find that niche, those points of difference that's going to set you
Right.
apart from everybody else.
As a new graduate, you want to be doing a little bit of everything. Okay, I get that, but ultimately you need to find that niche in the marketplace.
Love it.
And the last niche the niche that you don't want to have is the niche where you are the cheapest dentist around. Okay, because that is some people's marketing ploy, and that is not a long-term viable situation.
And it's not long term. I listen to Jesse Green's podcast all the time too, and he says it all the time that it is a race to the bottom.
Yes.
Yeah,
Yep.
that's
Yep.
it.
It's a disaster.
Yeah.
So the new graduate also, there are a lot of courses around. You also need to challenge yourself as well. Okay, you need to be just gradually expanding. You don't want to be doing, let's say, simple extractions to start off with when you're taking out teeth. Then, do a course on surgical extractions. Try to do some surgical extractions with your mentor watching you doing it, for example, and gradually build up your confidence and build up your skill set that way.
Wonderful. Yep. You must have a good website.
Okay, so for the new graduate, and the other thing is, I don't think a new graduate should be opening up a new practice either. I don't think that's a good idea either, because patients will become very aware of that very quickly. Okay, a new website, really, really important, and you need to make sure that you're out there. Social media. The thing I find with social media, for example, social media itself doesn't necessarily bring in lots of patients itself if it's the social media that you generate. Okay? But if there is social media where other people are talking about you, that will generate a lot of patients.
And it just helps build out, this is who we are.
Yes.
Yeah. So when they do come looking for you, they get a clearer and clearer picture because of all of these avenues of research of who you are. When we then went into the teams and to teach people, whether they're experienced in dental or not, reteach them how you guys do things at your practice. That's just key. Otherwise, there will be a slow attrition to your systems, your philosophies, your policies.
Yeah, absolutely.
And family coming first. You reminded me of Jay Abrahams. He said once, until a staff member knows that you're putting their needs first, they will, one, not care so much about your needs, but number two, they'll always need to have their own back first because nobody else has got it. And if you assure them we've got your back, then they can relax and trust back into that and just have to worry about the performance that they put forward.
I agree. I love the way you've put that.
Yeah, love it. And making a very pleasurable working environment has been one of the keys that you've managed to retain long-term team members as well, and making sure that you're doing everything to make sure it's not a toxic environment. And certainly there have been so many stories that, of good team members leaving and the bad ones stays. You want to make sure the bad one goes.
Correct, yeah. So, having the occasional social event or something, a lunch, a morning tea, something like that, maybe going out, not just the Christmas party at the end of the year.
Yeah, that's right. And it doesn't have to be a huge amount of planning.
It doesn't have to be extravagant.
Yeah.
It doesn't have to be extravagant. It just has to be a little bit of more personal, non-clinical time with the staff.
I love it. Yeah. Recognition, very important. And when we came to patient communications, the intraoral camera is a part of communication, a big part of communicating with your patients.
And it's simple. It makes it easier.
Yeah.
It makes it easier.
Seeing is believing.
Yeah, and it's a small investment.
Yeah.
Yep.
Written quotations for patients, but be flexible in the delivery of those treatment plans as well.
Yep.
And surround yourself with great people when it comes to facing any part of this industry. Just surround yourself with great people who can help lead you and guide you to the right decisions.
Yeah, and there are experts around like you. Like, you can't expect a dentist who's come out of 4 or 5 years of dental school to be able to teach a receptionist, for example, what to do. It's as simple as that. Okay, you need to rely on experts in that area to teach your staff how to be the best in that area.
Yeah, love it. Well, Jeff, you've been such a tremendous guest, beyond my wildest expectations. Thank you very, very much.
I've actually really enjoyed it.
Well, anytime you want to come back and expand on any of these items, I would love to have you back.
Let's do that sometime in the future.
Sounds tremendous. Okay. You have a fantastic lunch now.
Thank you. Thank you very much. Bye for now. Bye.
If you enjoyed today's podcast, then you should come along and join the club. The club is a whole library of lunch and learns, with new lunch and learns being produced all the time, that help your dental team gain greater success in your systems, in your team behaviours, in your patient management, in your patient engagement, in their treatment plans. They are usually around half an hour in length, and so team members can sit down, be paid for their lunch break, eat lunch while they're being inspired, and delivered all of these insights and strategies that can be implemented so you all achieve greater levels of success. Also, Amina and I, my buddy from Dental Management Expertise, have a company, Dental Business Mastery, together. And our flagship online 1-year course for dental practice managers and dental practice owners to learn how to very successfully manage your dental practice is available. Head over to dentalbusinessmastery.com.au to find out more information, and has information about any other courses that we've got available. Also, make sure you do jump onto my website, julieparkerpracticesuccess.com.au, and you will see a whole load of free information. There are articles, the blog, downloads, templates, a whole load of things that are designed to help you overcome any specific challenge that you've got going on in your practice at the moment. If you have any suggestions of topics or guests that I can have on the podcast, please let me know. Thanks for listening.